It's Wednesday night here in Washington. The president's just made a fine speech in there. The only problem is there's a huge philosophical divide. On the one hand, you have the president who wants a public option which I believe will lead to a single-payer system of health care. And you have those of us who want a private system where private insurance companies help us with the things we can't afford to get from private providers. That's what I want to keep. The president wants to head toward a public option leading toward single-payer. That's the big divide here. There's also a big question about, Mr. President, why not be explicit about excluding abortion services? Then you can take that off the table. Of course, I really like the idea of the president saying that the plan that he's talking about shouldn't add a dime to the federal deficit. If that were true, wow, what a deal. The problem is he's excluding about $245 billion worth of cost savings that they already count somewhere else. If he excludes that and does the funny math, then you can get to that claim that it doesn't add a dime to the deficit. But if it were a true claim, wow, that'd be a great test. Hope we can get there. Hope we can do the tort reform he was talking about. That's a good concession from him to at least mention it. Of course, he's not exactly fully embracing the idea, but at least he mentioned it. And he said something very important, that really the deficit is about health care. You got to get the cost of Medicare and Medicaid under control. No reason it has to be done by the end of the month or the end of the year. It's a structural problem that's going on for a while. So there's no reason to rush, certainly no reason to push something through the Congress, ram it through on the Democrat side of the aisle. This is something too important to do that. But hopefully we can get to the right numbers where we're really talking accurate statistics, accurate numbers, and honor the principles of free enterprise rather than government intervention, and honor the sanctity of life. Bob Inglis, thanks for listening.